this clinical development plan, and you've said a device with sufficient quality and level amount of data is a device with sufficient amount and level of data is this. And now we're going to use the clinical evaluation to determine what we've got, you know. And as you could imagine, if you're in the pilot stage, if you're in the pilot stage, that might not be as much. But if you're in the pivotal stage, one would hope you've gathered and generated that data. If you're in the sort of pivotal stage, then again, you would hope that you are adding to that data. And then obviously, if you're in that sort of observational stage, post-market stage, then one would expect that you are ultimately now in a position where that sort of sufficient amount, sufficient quality of evidence has now been achieved. And if we look at that just visually, you know, we would, if my handwriting could get any better, I have no idea what is wrong with this pad at all. It is not reflective of my handwriting, I promise you. But if we were to talk about the sort of the pilot stage, we would want this sort of amount of evidence to support, as we mentioned, indications, the intended purpose, the GSPR, the specification and methods, the qualitative and quantitative aspects of the clinical safety, the benefit risk. You know, if we move to the pivotal stage, we might now need a different type and amount of data. So we might still have that sort of preclinical, you know, evidence, non-clinical evidence, and we'll still leverage the same non-clinical evidence here. But now what we've not got to do at the pivotal stage is get this type of evidence. And I don't know what that type of evidence might be, but that might be a randomized controlled trial. It might be some other studies. And then at the post-market stage, we've set out exactly what sort of evidence requirements we want, which again, rely on the preclinical, they'll rely on that clinical, but now they're sort of relying on the observational data. So now we're moving in away from the confirmatory data. So as we said, that might be, one would call that exploratory. This would be confirmatory, and this would be observational. And it's at that stage you use the clinical evaluation at this early stage prior to the clinical investigation to basically go, have we got this? Have we got this? Have we got this? And obviously various stages we're going, I've got nothing there, but actually I've got a bit of data here, but I don't know whether it's sufficient in terms of the level or the amount of evidence. And of course, what that does is that begins to inform whether or not you are going to undertake clinical studies and what type of clinical study you're going to undertake. Is this going to be post-market because you've got sufficient confirmatory, or is it going to be sort of pre-market